Um, my name is Brooke Ostrom. I'm the Director of Marketing here at Meals on Wheels Central Texas, and I'm really happy to be hosting this session today. So this is our weekly series where we just dive in and get to know different staff members and different departments and programs a little bit more. And today we're being joined by Seanna Marceaux. She's our Vice President for Nutrition, Health, and Impact. And Seanna, if you just want to kick it off with introducing yourself and kind of telling us how you got to Meals on Wheels Central Texas.
Absolutely. Well, hello, everyone. It's a pleasure to be here and meet you virtually. I'm Seanna Marceaux, as Brooke mentioned, and I've been at Meals on Wheels Central Texas for a little over 12 years now. And at that time, our department was the Nutrition Services Department, and obviously meals in our name. So I oversaw the menu, all the medically tailored meal menu planning, etc., and everything that comes along with that. What brought me to Meals on Wheels, though, I would say I've always been a community helper, if you will. I started my career as an elementary educator, and I did that for 5 years in San Antonio, Texas. Really enjoyed that, but I also have a passion for nutrition. So I went back to school and I was very excited to find something in the community. And I was an intern rotating through Meals on Wheels. And that's when it opened my eyes up to a lot of things. And I was really grateful and honored to start out my dietetic career at this wonderful agency. So that's how I got here.
Yeah, that's awesome. I know that you mentioned we were called Nutrition Services. We've had a shift in the last few years to Nutrition, Health, and Impact. I'm going to ask you kind of to expand a little bit more on your department, but can you talk about like that switch in particular, and then like who's on your team and what they do in your
Absolutely.
department?
Absolutely, yes. So change, especially a change like this, it really began many years ago, probably a good 10 years ago, when I was, overseeing the menu development, all our medically tailored meals, kitchen sanitation, nutrition education. I started to wonder, right when 2008 hit, that we had that recession and we had our wait list for the first time. And I started to think, how are we going to prioritize who gets meals next? And it just got my wheels turning with what evidence-based screening tools can we use to allocate limited resources? How do we know our meals do anything? You can say you put out 3,000 meals a day, but are they eating them? Is this really making a dent in people's food insecurity? Or if they're malnourished or at risk, is it really improving that objectively? So I kind of began on this quest of kind of looking at screening tools, and I found one. And so lo and behold, several years ago, I started evaluating our meal program. And we are able to show the last 2 fiscal years in a row that 2 out of 3 new clients that come onto our program, 65 years and older, they're screened by this validated nutrition screening instrument. And if they're found to be malnourished or at risk, they're flagged. They get enrolled into our program if they're eligible, and then we start meals. And 3 months later, just 3 months later, after the friendly volunteer visit, the medically tailored meal at their door, 3 months later, my staff follows up with them in the home, re-administers the tool, and we were able to show that 2 out of 3 improve in just 3 months. And so that's when our first kind of really solid metric kind of was born. We started sharing that with more funders and started to really just wanting to demonstrate the efficacy of our programs. And so as I was doing this with the meal program, we started kind of assisting other departments with our other awesome programs that we have. And so, it just kind of was an organic process over time. Adam came on board, and our visions in this regard aligned. And so the Nutrition, Health, and Impact Department was born a year and a half ago, actually almost 2 years ago now. The nutrition piece is obviously the meal part. I mentioned medically tailored meals. Another thing that makes us unique compared to other home delivered meal programs across the nation is we have the MTMs, but we also provide a choice meal program. And so we really want to make sure we promote that dignity and respect for those that we serve, and everyone deserves that right to choose their meal. We wanted to really move away from that institutionalized feel where you kind of you don't have a say and you kind of get what you get. So we're really proud to be able to offer both of those things. Both of them are enhancements to our meal program and make us very much a unicorn on the national scale. So that's the nutrition piece. The health in our name, we are the department that implements new health initiatives. So whether it's with a collaboration with Dell Medical School and actual academic research we're trying to prove out and create a case for healthcare payers, but it's also ones that have already been proven, like the Capable program through Johns Hopkins University. And so we're the department that kind of gets those off the ground, because we're also the impact piece, which we develop the metrics and the evaluation around it. So anytime you're beginning a new program or testing something out, a pilot, you always have to gather data and be able to demonstrate that the program or project works, and what are all the outcomes associated with it, and make data-driven decisions basically moving forward. So my staff, it's always quality in life, right? Anything, quality, not quantity. We are a very small, powerful department. We have 4 of us total. So along with me, I have another registered dietitian nutritionist who's bilingual Spanish, and she's Nayeli. She also has clinical experience. She's our nutrition program coordinator, and she is the main liaison between our food service company that operates our kitchen and all the menu development and everything going along with food safety, etc. So she does an incredible job, and she has diverse skills though, so she's into the data like we are too, so it's fun. Lauren Sessor is our research and program analyst. She's a public health professional. She has her master's in public health, and her main focus in school is epidemiology. So she is our main data analyst, and she leads a lot of the program evaluation projects. We just transitioned to a new database not quite a year ago. And so we're still, not only we're involved in maybe some new data points we wanted to collect, but also how do we pull that data? How are we moving forward with this transition? Because it does take time. So she really spearheads that for us as well. And we have Stephanie, and Stephanie is a registered nurse. We brought her on last December to be our program manager for the Capable program. That was one of those health initiatives I mentioned. The Capable program has an occupational therapist involved, a registered nurse, and a handy person. And it's a 4 to 6 month intervention with clients who are having trouble with activities of daily living or instrumental activities of daily living. And it really works on goals that they want to focus on to help them age in place. And so Stephanie's role, she kind of wears 2 hats. She is the program manager, but she's also the RN component. And we brought her on, and you know, one of the questions might be, how has COVID impacted our department? Both of our really big health initiatives, Capable being one, another one with Dell Medical School. We were literally on the starting block, and we were down, and they were almost going to blow the whistle, and then COVID came through, and we had to halt, which is probably good, because we wouldn't want it to have started and then had to drop the participants out. So she's been helping us with our Care Calls program, that kind of resurrecting that. It's a program we had a long time ago, kind of like a friendly phone call system, just to make sure our clients who are at most risk for social isolation and loneliness and live alone and have a little support, have a phone call buddy. So she's assisted on a lot of levels with volunteer coordination and other public health aspects until we can get Capable off the ground again. So
yeah. So I know you talked about data collection and analysis a little bit. Obviously there's the entry point of like someone coming to us for services, but what does it look like, I guess, like throughout when you're evaluating? How do you kind of execute data collection and analysis in your department?
Yeah, well, let me give one example of how we use the data to make decisions. A perfect example, especially for a nonprofit, is when you have a cut in funding all of a sudden. And a few years ago, we have a second meals program where we're able to provide breakfast to a very small subset of clients. At that time, it was, at the time we had that additional funding, it was over 300 people. So a very small amount of our clients. And all of a sudden that funding was pulled. And so at that point, we have to make the decision, how do you decide who gets to stay on the program? And that's a really hard place to be in, because I feel that every single one of our clients should be given breakfast and lunch. But then you look at that 300 and, how do you decide? And so data helps, we still have the data to help make decisions. We still have the heart that goes along with it. So, but when you have to make that decision, doing so in an objective way was the best way to do that and be able to sleep at night. So I had been wanting to for many years to implement the USDA food security questionnaire. And what the beauty of this tool that we use to measure food insecurity is it's not a positive or negative, food insecure or not. It shows varying degrees of people's food insecurity. So the score is a 0 to 6, but the scores 2, 3, 4, 5, 6 all mean food insecurity, but the 6, 5s, and 6s are the worst off when it comes to food insecurity. So we were able to use that as an eligibility of the program, that everybody on this program needs to have scored in the category of being food insecure. And then we had a wait list and we prioritized it. The 6s go first, then the 5s, etc. So you're able to help target those resources using an evidence-based tool, and it just really helps. It just really helps the efficacy of the program and just making sure you're targeting what you can with limited resources.
Yeah, you also brought up a little bit of like how COVID has impacted your department. Can you talk about how it's impacted basically like our meal operations and everything that goes into that? It's quite a big question, but
yeah, no, it's okay. I think the whole world, everybody, I mean, we didn't know what was coming. I mean, we do. I mean, I'm a science, I have a master's in science. I understood it, but you just had no idea what this was going to be like. And we know we serve the most immunocompromised citizens in our community, older adults, lots of chronic conditions, being homebound, etc. So right away, knowing that we had thousands of volunteers come in to deliver to thousands of clients, we were a vector for this virus. And so, I mean, we took a very conservative, we pivoted quick and took the most conservative approach because of that reason, and for the safety of our volunteers as well. So we had to quickly shift from our medically tailored hot meals that we're very, very proud of, and we cannot wait to get back to a shelf-stable meal product. And instead of daily deliveries, we had to do a 1 delivery every 2 weeks, but we would provide all of our clients with 10 days worth of meals. So, and this was not an easy decision to make for any of us. Lots of analysis went into it. The pros and cons list, the shelf-stable won, but not by a lot, but it still won out. And since then, we've learned a lot about the virus. We've learned how to implement safety protocols better. So we're looking forward to getting back off the ground. But, we did survey, being the evaluation team, we've done 2 phases of a COVID survey for our clients. We did phase 1 in April and May, and just kind of wanting to see how the clients are reacting to the shelf-stable meals. How is the virus impacting them? What are some things we need to know about? It was quantitative and qualitative, so we had a lot to go through. Then we used the qualitative information to inform our phase 2. And Lauren is about done with that analysis. And we're going to present to our board next week on both of these. But one of the things that stands out from this is we asked the clients if they felt, this was a random sample. Let me say this again. This is a random sample, and the N was 299 clients. And asked them if they felt safer with this new delivery protocol, less frequent touches by volunteers, etc. And 80% of them said yes. So I think that gave us the reassurance. Again, that's a way to use data to say, okay, this was a hard operational decision to make, but we did so in the right way. And I look forward to seeing if their minds have changed. We didn't realize how long things would be going on. And so we called the same people back, re-administered some of the same questions so we can see what has changed for them. And we've added a whole lot more. It's a little bit more of a robust survey, but that's what's changed. And throughout the shelf-stable meal delivery, the menu has changed. The food supply when it comes to shelf-stable product became very fragile. Not when you walk into your local grocery store in the retail market. Well, it did at first, right? Everybody panicked. But you still go today and you're saying, what do you mean, Seanna? We can only get carrots when at the grocery store, I see the wide array. Well, that's retail. When you do PC, portion control, which means single meal serving style shelf stable, that's a completely different product. You get it from a wholesale environment. It's very different. And the demand went up. FEMA was wanting it. So we were struggling here and there. But I tell you what, the one thing I'm proud of, we never missed a meal. Our clients never once went without a meal during this entire time. And so since COVID hit, we've served up to 440,000 meals to our community. And some of the people we've been able to serve aren't our typical clients, just other at-risk people that needed to stay sheltered in place, that with the additional funding we were able to help. So that's still a real positive thing. And based on the survey, the clients rate them pretty good. I mean, they're not ideal. We understand they're not medically tailored in that sense, but it's still nutrition. It's still 79% of clients say that it's still an essential part of their daily nutrition. So I know we're still making a difference. We're all eager to get back to our medically tailored hot meals.
We do have a question in the chat. So is there any information about a client's ability to manage basically the boxed meals, so they're getting the 10 at the time, and are they running out before the next delivery? So you can kind of talk about, like, you know, the frequency that they already get the meals before this.
Yeah, so so the first one was managing the product that comes to, I assume that means, are they able to open the box and open the items? I don't know if that's what.
Possibly. Maybe it's just like the sheer volume, I guess, of what they're getting. Yeah.
Well, the great news, so that's a really good question, because what we started out when COVID first hit was we tried to go just 5-pack frozens to try to stay with the frozen meal. And in part of that phase 1 COVID survey, we asked the clients, would you have been able to hold up to 10 frozen meals at one time? Because that would be more ideal from the product we wanted to provide our clients. But only 50% of them said they could hold that in their freezer. So that means that is not an appropriate product to send out, because they would not be able to store it. The beauty of shelf stable is that it's stable on the shelf. It just really needs to be at room temperature is the ideal. So you can use your pantry, you can use your counter. And so that storage, that hasn't been too much bulk. Now, over time, as our menu changed, the one we send out right now, 5 meals, it takes 2 white plastic bags tied together. It's very bulky, but it's a higher quality meal. I mean, so it's one of those things, if you want a higher quality shelf stable meal, it definitely costs a lot more, and it is more bulky, but it's much better for the client. And they have enjoyed that meal, for as far as I can tell, more than the one we had to start out with. And so that they're able to handle that volume currently, because it's shelf stable. So that's good. And there's no food safety issue with that, because if the client's not home during this situation, during shelf stable, we were able to have the volunteer leave the shelf stable on the porch, because again, that's your one shot for getting 10 meals. Granted, we would still deliver if people missed them, but we couldn't run the risk of leaving frozen. You know, you can't. Food safety is very important. So this helped us do what we needed to do. I forgot the second question.
Well, it's about running out of meals, but I know each client can be different like, you know, with our normal operations, not everyone gets Monday through Friday. Some are Monday, Wednesday, Friday, some are Tuesday, Thursday. So there's you know, can you talk about that? I guess there's some kind of analysis into how often people are getting things, but with this, I'm not sure.
Well, we're giving the same amount of meals that we would have. It's just all at once. And so they do kind of have to make sure that they're, you know, rationing, if you will. I mean, before, the fact that you're only providing 1 meal to clients, you know, that's 1 meal. And so we've always known that, like I said, I've always wanted to give people at least 2 meals. That would be great. So we even before COVID, some clients who would run out of food, we would refer to our HOPE program or some additional supplemental food programs. In this situation, we still have, you know, the client services team does a great job of also trying to find other resources for them. HOPE's still operating. So I think we're still doing the best that we can in that situation. And one of the questions we did ask on the COVID survey was, are they receiving any additional help with getting food or groceries? And let's see, at the time, so this is April, May, I'm looking forward to seeing if whoever's helping them stayed true. 78% said that they are also getting help. So that made us feel better too. They're getting additional help. We're not the only one for all of them. But again, I want to see, did that help sustain through these last 6 months? And we will find that out shortly.
Sure, yeah. Let's get into what your favorite part about working here is, and kind of like, I guess what makes serving our community important to you.
Well, as far as, I'll start with the second half. Again, I'm a former teacher and I've always loved children and child development. I have 2 kids of my own. You can't hear them right now because family's helping me keep them quiet. But I knew that children, especially in the school system with free and reduced lunch services, I knew that they had a lot of support from our government programs. But the older adults really don't, not as much. Granted, I'm grateful we have the Older Americans Act, the Texans Feeding Texans through the TDA, things like that. But I have a soft spot for our older adult population. They have so much wisdom. And I think, like I would always tell students when they'd come, think of how awesome and independent. You're independent, right? You're 23, you're independent. Doesn't it feel good? Now imagine, and I would like take them through this scenario. I was like, can you imagine what that would feel like? You love being independent. So do they. They don't want to ask for help. And so I feel like we owe it in our society to treat our older adults and older citizens with dignity and respect. So it feels really good to give back. The fact that they have more mobility issues, and so many of them really want to do for themselves, but they can't. And that's something that can naturally happen with age at times. And it feels good to be able to help with that, especially if you've got a chronic condition. I mean, you can talk to a 40-year-old person who needs to follow a diabetic diet, if you will, to control their blood sugar. And that's hard. It's hard for people to learn to, number one, what does their plate need to look like? What about cooking skills? Some people don't have the cooking skills. When you throw mobility on top of that and multiple chronic conditions that may, like diabetes and chronic kidney disease, they kind of go hand in hand if you have uncontrolled diabetes, that makes my mind blow. Mm-hmm. So to be able to show up with a medically tailored meal suited for their medical condition that they are hot and ready to eat, yeah. I mean, it's a win-win. It's beautiful in my opinion. So, but I also love working at Meals on Wheels Central Texas because of the people around me there. I mean, their hearts are so big. I love hearing all the stories from our case managers and all our and more programs. I don't have direct client contact anymore, but I really enjoy hearing all the stories, and I just enjoy the work we do.
Yeah.
I love that we're evaluating programs now. I'm ready to help take the agency in a new direction with this. It's really important, no matter what you do in life, wherever you work, whatever you do, you should always evaluate what you're doing and your worth. And we are evaluating the worth and value of what we do for those we serve.
Data nerd, Seanna. What would you say is the best way that people can help us right now? Probably getting that question quite a bit.
Volunteer. We need, it's a hard time for volunteers to maybe want to come out during this time frame, but I would say our biggest need right now as an agency, the more volunteer engagement we can get, the faster we can get back to our hot medically tailored meals. I would say volunteering, and then obviously monetary donations always helps, but I would say we need some volunteers added to our fleet.
And I have one more question for you. So you've touched on a lot, and I think that this whole session has been really fascinating and interesting, but is there anything in particular that you want people to walk away with knowing, or, one important lesson, I guess?
Yeah. Meals on Wheels Central Texas is we were founded on philanthropy and the goodness of volunteers' hearts to cook. In 1972, I don't know, it was like 8 clients and a few volunteers. And it's just amazing. And food it connects everybody through every event in our lives, happy, sad, good, bad. And when we show up at the door, we are bringing that love and care, and most definitely. But it's not just a friendly greeting from the community. It is literally a medical intervention that can improve people's health. I mean, it is just it is very powerful to provide a medically tailored meal to someone with chronic conditions. We can actually keep them in their home longer, and that's a much more cost-effective approach to our future and aging in place. So I just say, yes, the heart's there, but so is the benefit to their health. Both of them are there at the doorstep.
Yeah, absolutely. Well, it looks like we don't have any more questions in the chat. So I think we're going to wrap it up. I just want to say thank you so much for sharing your time today and, you know, kind of talking about your department and everything that you guys do. It's just, I always love listening to all of the, you know, insights that you share about what we do here. So you guys can visit our website if you'd like to join us for the next session. You can go to our Get Involved tab under events. Our next session will be on our volunteer services and distribution department. And we're taking a break next week, but we'll be back the following week for that session. And then we'll be adding more sessions to our website too. And if you've missed any, you can also go to our YouTube channel, and we'll be uploading this one later today. And there's all of the past sessions on there already too, so you can watch those. But thank you so much to everyone for joining us today, and we'll see you the next time.
Thank you, everyone. Thanks for the opportunity, Brooke.